Welcome back to Relational Lives. Today we have again a special guest, Dr. Graham Campbell from Flint Healthcare in Sussex, who is going to talk with us about autism. So stay with us, and also remember to like, subscribe and follow, and you'll be able to get all your episodes with us. And it's below, yes, as Ali is indicating. Here we go.
Okay, thank you so much for coming back here, Graham. And do you need some breakfast?
I think I do. That's happened on a podcast before, actually. My stomach gurgling.
Is it nerves? Yeah. Is it nervousness?
Yeah, it might be. It might be the wine gums before we started.
I thought you were going to say it might be the wine before we started.
Yeah. Bit early.
Yeah. So this time you're going to be talking with us about autism, and particularly autism in adults. Yeah. We thought we'd focus on that because I think we're seeing more of that, aren't we? Where people have perhaps had one of their children diagnosed and sort of considering, oh, maybe that's me as well. I think the first thing to start with maybe is, what is autism? What is autism spectrum disorder?
Yeah, so that is a big question,
right?
And quite a complicated one, but it tends to boil down to a couple of main things, and that can. So essentially, it's a neurodevelopmental disorder, which means it's a condition that starts really early in life, and maybe even sort of pre-birth, and then runs throughout life. It's not a condition that you can sort of grow out of. It's kind of like the way you are, really, the way you're built.
The way you're wired.
Hardwired. Absolutely. Although, yeah, I could go off on a tangent already, but the sort of hardwiring thing is, I often think there's always a degree of flexibility, but I often think of neurodevelopmental disorders and like autism to be a bit like the foundations of a house, the foundations of a building. So, if you build a building and you want to change it, build an extension or something, that's a bit easier than sort of changing the foundations. And the foundations, is what are the sort of core, they're the sort of important bit that supports the rest of the structure. So it's it is sort of like the way that we're built. It's it's quite a sort of pervasive in that sense and difficult to change. But what it tends to come down to is sort of social and communication difficulties, and then sometimes repetitive behaviours and intense focused interests, and there's a lot more I'm sure we'll talk about, but those are some of the core features of autism.
And would you say there is a difference between the genders in terms of how autism, kind of the presentation of that comes out, as it were? Yeah,
I think so. I mean, when we talked about ADHD before, I think we had in mind this sort of classic presentation of a young boy at school with ADHD, and that's the sort of lay kind of general thinking about the image we have of ADHD. And I think it's the same with autism, really, that we often think, or maybe pick it up more easily in men, and we often think it's a sort of male disorder, or I think there was a researcher who said it was like an extreme male brain, but the current thinking is that it is equally divided between males and females, but it is often harder to pick up in women because they're often better at masking, maybe, and that's probably the main thing. And there was a study that showed that if you gave a teacher a description of a pupil at school, and you put a male name on the top instead of a female name, then they're more likely to refer that child for an assessment if they had a male name than a female name.
That's so interesting, isn't it? So something that's already set up in the sort of system of the teacher in a way, and how they, or society, I suppose, it's a sort of representation of that, isn't it?
Absolutely, it's what it's what we expect.
Fascinating.
Yeah. I think it's interesting how the girls tend to mask more easily, or they somehow are able to do that at quite a young age.
Yeah, Yeah.
I wonder what that's about and whether there's anything written on that.
Yeah. I mean, with all these kind of conditions, there's a little bit of this, you know, this social expectation and the society that you, the culture you live in can have an impact. Obviously, you know, we know that girls tend to mature emotionally perhaps and socially a little earlier than boys, and so maybe there's something there. So I don't really know the answer, but it's certainly a little more difficult to detect, and really not obvious.
No,
I think I think there is a myth that you can sort of easily tell if somebody's autistic, and you can just, you know, look at somebody and they're clearly autistic, but that is really a myth. Because it's apart from masking, it's much more complex than that.
I know I've had adult clients who, in the past, I would never have picked up that there would have been autism there.
Yeah.
And then they've been diagnosed. Yeah. And I've been, well, how did I miss that?
Absolutely.
So it's still a surprise when you hear that they have been. You're surprised by that, or do you think
Probably
then it
now,
makes sense?
You know, because there's much more information out there now, and I know more about it. And I think I might have thought about now, if that person had come to me, I might have sort of thought, oh, maybe. Yeah. But at the time, I had no clue. No idea.
Absolutely. It's probably I have to admit, it's probably the last 5 years that it's really come onto my radar more. And I think maybe I, again, said this about ADHD, that in my previous career, you know, we learned a bit about autism. And, you know, certainly when I worked in the hospital, I'm sure a good number of my patients had autism traits or really had undiagnosed autism alongside maybe other conditions. But it's only really in the last 5 years, with more information and actually working a bit more closely with people who have autism and ADHD, that I've really kind of learned more about it and feel more able to sort of pick it up and ask the questions around it and screen for it. So it's funny. I think it's probably the case for a lot of people in mental health services as well, that, you know, we were perhaps misdiagnosing or just, you know, writing it off to personality traits and, you know, things like
attachment stuff and
absolutely
easily done, isn't it? So what does an autistic or autism diagnosis involve? Could you kind of, people who are listening to this, what would they would they do if they came to you?
So something people can do, and something I sometimes do, is offer a screening questionnaire. So this isn't really diagnostic, and there's a similar questionnaires for ADHD. There's one called the RADS R. It's RAADS-R. But it's an 80 question questionnaire. But it really kind of gives you a sense of, in quite a simple way, of how many traits you might have. And it's a little bit black and white, and it's the answering of the questions.
Intentionally?
I don't know, actually. Maybe. Or maybe they're looking for, you know, certainty in the individual about whether it really kind of... So it's quite quite simple, straightforward questions. But that can be a good indicator. And sometimes, you know, if I have a patient in my office who wonders about it, but it's not the main reason that they're coming, I might give that questionnaire for them to think about, and we can talk about it, you know, next time. But if I feel that somebody, you know, could really benefit, and if they want to have a full autism assessment, then in our clinic there's a specialist, Dr. Rick Fraser. So he's got a lot of experience over years. You know, I think for initially perhaps from a sort of research setting as well, but certainly clinical experience of a full autism assessment, and it takes time. So it can be a sort of couple of hours of interview, in lots more questionnaires, of course, discussion with family members, and really going into the details of a person's lived experience and life history, and early developmental history. And
is it a longer assessment process than for ADHD then?
That's a good question. I think certainly, I mean, both tend to be longer than a standard psychiatric assessment, because you really have to go into detail and you really have to look at the diagnostic criteria and explore things in a lot more depth. So it is probably a bit longer than the ADHD assessment, and really it's looking at sort of social communication, sensory processing, information processing, the way that people actually take in information and learn. Sometimes it can be about executive functioning, a little bit like ADHD. The sensory processing can be sort of hyposensitivity, so people need a lot of sensation and a lot of stimulation. Sometimes it can be real sensitivities. So
it can be hypo as well.
Yeah.
So you hear a lot about people very, very sensitive to sensations, touch, taste, textures. Yeah. But not so much about the undersensitivity. No,
absolutely. Sometimes people need certain noises, or really bright colours, or physical contact. That we hear about the sort of weighted blanket.
Yes,
that can be really helpful. But a whole range of different sensory difficulties.
And I guess this is also highlighting how also, even though we're talking about an autism diagnosis, is that everybody's different.
Oh, yeah.
And it's so, there's that kind of thing that people say, isn't it? When you've met one person with autism, you've met one person with autism.
Absolutely.
Yeah.
Absolutely. There is a real uniqueness to each individual. And even things like stimming, some of the repetitive behaviours that people do, which is self-stimulation, but also can be self-soothing. There's such a range, that everybody, we often hear about hand flapping, and that people can wave their hands or clap or jump, and but there's so many different ways that people can stim, and asking about that can be tricky, because sometimes people just
think it's a thing that they do.
Absolutely, yeah, and it's normal for them. So why would you kind of think about it differently?
It could be like, I've had some people that were just that kind of very subtle thing with their fingers, but
and hair twirling, things like that can be quite subtle and just don't get picked up by other people, very much. So there's quite a lot to the assessment, and what you're really looking for is a fair constellation of autism traits and a degree of difficulty that come with those. It's usually something that really has to have a significant impact on the person's life. The people have a lot of strengths with autism. That comes with its positives. A lot of people will say, there can be some good things and really helpful things, and a lot of famous and very successful people, have autism, diagnosed autism. But there are often some real challenges that make life incredibly hard for people.
What do you notice? Because I know the people that I've seen, I guess one of the biggest challenges is often social. Friendships and relationships can be very difficult. Is that what you see as well?
Yeah, absolutely. I think because we're such social beings, and so much of our mind is dedicated to navigating the social world, and so many things that we take for granted. If we're neurotypical, they can still be challenging. Let's say, it's not. Not all neurotypical people are super confident extroverts who fly through social situations with no problems. But it can be intensely challenging for people with autism. So kind of reading social cues, taking turns in conversation, humor, understanding the sort of sarcasm, the nuance of communication, understanding jokes, dealing with crowds, dealing with groups of people can be really, really hard. Making small talk.
And I think it's so hard, isn't it? Because, the sort of neurotypical world who's around somebody who's autistic don't necessarily see or understand what's going on inside. And I think that's something I experience with my clients who are autistic, that there is so much that's going on inside just for one tiny, from a neurotypical point of view, something small to do, to go and ask something in a shop or something or whatever it might be, that it can be actually a really, really big thing that's going on for that person.
Absolutely.
Who's autistic. Yeah.
Absolutely. And I suppose for a lot of people, that's where the masking kind of helps. You kind of learn techniques to kind of manage, and from the outside, it might not be obvious at all.
No, but it's exhausting.
But it's absolutely exhausting, and it also can change over time as well. So people can, appear very functional and be very functional sometimes, but then, life circumstances change, or there may be other mental health conditions or stressors that can really lead some people to decompensate and then have a much more difficult time. And then it's even harder to say, to people, now I'm struggling, but then I wasn't. And it gets really, really difficult. And then, people with autism can blame themselves and become, like we all can do at times, very self-blaming.
Sort of shame can go on, can't it? Yeah.
Absolutely. Real self-attack.
And I'm broken, what's wrong with me?
Yes.
Absolutely. Yeah, absolutely.
And I think it can be a very big voice, that self-critical voice, can't it?
Yeah, absolutely. And that's really where often the benefit of diagnosis can be is in self-understanding and actually realizing, or, putting it all into place that actually this is not my fault. This is not something that's just wrong with me. I'm not a bad person. This is just autism, not just autism, but it's kind of it's autism that's been,
so maybe some kind of relief that comes with that. I think also I've noticed with people who have got an adult diagnosis that there is a part that's a relief, but also a part that's really angry that it hasn't been picked up before, and all the struggles through their life.
Absolutely,
which I think can be another element, can't it?
And I've heard it described as it can be really traumatizing, that living with autism for a long period of time, for some people can be really, really traumatizing and give rise to so many difficult experiences, so many really, really challenging experiences that you can kind of learn that, the world is a very, very challenging, unfriendly, unforgiving place.
And I guess that's undiagnosed or diagnosed, isn't it? That it can be the traumas that can come with that.
Absolutely, yeah.
So, go on.
Yeah, I was just thinking about, you've mentioned ADHD a few times here, and I've seen stuff on social media, on TikTok and things, where people are talking about ADHD.
Yeah.
And that's not a diagnosis, is it? But I was wondering, as a professional, what's your view on that?
Yeah. So
autism and ADHD together.
Absolutely. I've worked with a number of people who have both ADHD and autism. And I probably, I probably a large majority of the people I work with are people who have ADHD and autism, actually, because the people who have autism, they may have other mental health conditions, but, they may either stay with a specialist doctor, or they may not need sort of ongoing psychiatry input. So I work with a lot of people with ADHD, and they have autism as well. So it isn't actually a diagnosis in itself, but it's a nice shorthand way of saying, I have two diagnoses, and that they kind of overlap and interact with each other in different complicated ways, it can be expressed in different situations at different times, and
so it's not uncommon for people to have both diagnoses.
No, absolutely. I think if you have ADHD, you're more likely than other people to have autism, or certainly
that's interesting.
Yeah, or certainly autism traits as well. And I've worked with a number of people who are kind of around that threshold on the screening tools and in their own experience, really, of maybe I have some autism, but not enough to get a full diagnosis. But and then the other way around, you're more likely to have ADHD.
So what do you think about when you say, autistic traits, when, some people kind of band about, we're all a little bit autistic, and...
I'm a tad autistic.
Yeah, a tad autistic.
I am actually, I think, a tad autistic.
Okay.
But that's flippant,
Yeah.
Because it's a spectrum, isn't it?
Yeah.
And people talk about, everyone's on the spectrum.
Yeah. I've been guilty of saying that myself, actually.
You're a tad autistic?
Oh, well, I probably am slightly. No, I think, I think the rate of autism is higher in doctors.
Is it?
That's
yeah,
interesting.
I haven't looked at the research, but I've heard, people say, I've heard specialists kind of say that.
What do you think that's about?
Oh, that's a good question. I think that, attention to detail, a sort of, intense interests that kind of keep you motivated. It's probably some of those kinds of things. An analytical mind, I think there can be that. So, yeah, I mean, I think it's an interesting one, that being a bit autistic, because when we talk about the autistic spectrum, we often think of a spectrum between, no autism and, full autism, like a severity spectrum.
Yeah.
And if you take it like that, then only the people at the sort of zero end, if it's 0 to 100, are the people who don't have any autism. So, therefore, you can imagine that the majority of people on that spectrum are on the spectrum. And that's not really how the autism spectrum is.
Okay.
So it is possible to have some traits of autism. So when we before talked about, maybe sensory processing, information processing, social communication, all these different collections of traits, it is possible for people to have some of those, but maybe not the full spectrum, or the full collection, I suppose, of traits.
You said constellation.
Constellation, yeah. So not really meeting the full diagnostic criteria, but having, some of those traits. I can see how you might then say, I'm a bit autistic.
Is that different? Is that group of people who aren't necessarily meeting the criteria for the diagnosis, is that a different group of people to those who might just flippantly say, I'm a little bit autistic, or is that part of that same thing when you're talking about that spectrum?
I think it's part of that same thing, but it is quite nuanced, that difference, I think.
It's an interesting one, because I know people who are autistic who find that quite hard to hear when people say that. Yeah. When it's sort of bandied about, because I think of how hard it can feel for the person who is autistic. Absolutely,
yeah. It sort of devalues in a way, or it can, be seen to sort of devalue the, it might seem like it's sort of empathizing maybe as well, but then if that person with autism, like you say, is really, really struggling, and then they hear that, well, everybody's a bit autistic, and, then that does devalue. It's the same in other conditions, actually, mental health conditions. So OCD is a classic one. People say,
that, didn't I? Yes. People saying, it's my OCD playing up.
Yeah. Absolutely.
When they need to clean the house or something.
I've got a bit of OCD and things like that. But when people have, full OCD, or really meet the diagnostic criteria, it's very different than, needing the glass to be straight on the table and things like that.
And with autism, are there other common diagnoses that come alongside it? You mentioned ADHD. You've mentioned sort of OCD. Is OCD also maybe a common
So OCD, absolutely. So there are some other conditions that are sometimes thought to be sort of clustered with neurodiversity, neurodivergence. So things like OCD can sometimes be in there. People can exhibit very repetitive behaviours, but often for a different reason when they have autism than OCD.
Okay.
They can have, I suppose, like the obsessional interests, and be quite obsessional and analytical, like we talked about, when they have autism. And there's a little bit of overlap there with OCD. I've certainly worked with people who would meet the full diagnostic criteria for autism and separately also for OCD. Then other things like dyspraxia, dyslexia, dyscalculia. I don't know if you've, well, I mean, dyslexia we've heard about quite a lot. Dyspraxia is that sort of fine motor control difficulties. So maybe sometimes like using cutlery or tying your shoelaces and things like that. Sometimes people, with buttons and things, are sort of, that can be a challenge. Dyscalculia is having massive difficulties with maths, really a little bit like dyslexia for maths. So those things. Tourette's syndrome, that can be sort of part of that neurodivergence, neurodevelopmental cluster. And then most commonly, actually, the things that people struggle with are anxiety and depression. Again, the sort of challenge of living with autism, anxiety can be quite a sort of integral part of day-to-day functioning when you have autism.
Makes sense, doesn't it?
Yeah.
That those experiences could come alongside.
Absolutely. Yeah. And there can be certain thinking styles and cognitive styles that can predispose you to depression, that sort of negative cognitive bias, which doesn't just mean thinking negatively all the time, but it means being much more aware of the negatives. So that can be a challenge, and just the general difficulty of getting by and feeling connected or feeling part of a social group, and
What about eating disorders? I've heard that can be quite common in people with autism.
Yeah, absolutely. So anorexia, there are a lot of people who have anorexia who have undiagnosed autism, and sometimes the focus can be sort of excessively on the eating disorder and missing the sort of broader, the broader challenges that somebody has, and possibly also that kind of need for predictability and control and self-soothing and sort of managing.
And the focus on, I think, they can get very hooked on focusing on the numbers of the weight loss, of the number of calories,
absolutely.
The obsessional element of that.
Definitely, the rules and routines that can go with anorexia, and maybe also the sort of negative cognitive bias as well, because anorexia often involves that sense that your body is wrong or the wrong shape, or you need to dissatisfaction with your body. So
almost a manifestation of that.
Yeah,
the way that it comes out.
Yeah, absolutely. So I think I've often thought about this, that I do hear sort of quite cynical views just generally in conversation about neurodiversity, neurodivergence, and working with people who have ADHD or autism. You really see the value of helping people understand or giving the diagnosis, because even though it's I don't know, sometimes I still think the language can be, not everybody agrees with the sort of medicalisation of these things, and actually it's important that we consider autism and ADHD as like a variation. It's just a variation in the way our brains are and our brains work, and
that would be a really lovely way for society to think, wouldn't it?
Absolutely. Ultimately, I hope that we move towards a society where we just kind of accept and recognise and value each other's differences, of course. But helping people to the mental health burden that comes with autism, undiagnosed autism, and undiagnosed ADHD is huge. And I think if do you think because you're saying undiagnosed there, so is something about the mental health burden of it not being recognised, it not being diagnosed? Is that, I mean, how do you see that? Is that because people are being treated for the wrong thing, and so they're not really being helped in the way that they could be helped? Yeah, that can be a part of it. Absolutely. So I mean, certainly my mind leaps to ADHD, but I think it is the case. Well, I'll try and tease this apart. So, lots and lots of people with anxiety and depression who have tried all the different treatments and nothing really gets better, and they start to feel disillusioned, and maybe they sort of feel like they're just becoming a bit of a problem, and what's wrong with me? Why can't I get better? And that self-attack and all of this stuff can snowball and can happen. And then when they understand that actually it's ADHD or autism, and actually can then address those things with either treatment or environmental changes, or just learning more about the condition, and other people around them understanding as well, and maybe having workplace adjustments and things like that, then that can help a lot. That's not to say that getting the diagnosis makes everything better, of course. It's actually maybe over-egging that slightly. People still live with the challenges, but it really helps to know. It really helps to know.
I don't know if you experience this, but I know some of the people I've come across, they want to know, but they don't want an official diagnosis on their medical records. Is that possible in the UK? You know, that you could get a diagnosis, but it's not written all over your medical.
Yes. So some people do just do their research and know.
Yeah.
And, you know, I've heard so many people say that they tentatively mention to friends or family, you know, with both actually, that, you know, maybe I've got ADHD or maybe I've got autism, and they're like, yeah, of course.
Yeah, we thought that all along.
We thought that, yeah. Oh, thanks. Why didn't you tell me?
Yeah.
So then, yeah, people know, and they're very confident, and they you know, they have the recognition from others, and they don't need to go down that path and get a full assessment.
I think it's difficult, that one, isn't it? Because I think there are also the people on the other side where they might say that, and then because maybe they've masked, maybe, you know, it's not sort of seen as a known thing, that they can then feel as if they're a fraud.
Yeah.
I've had that as well with people.
Yeah.
So I think it's never straightforward, is it? There are always kind of different experiences. But I can hear what you're saying, that actually, you know, this whole notion of being informed and whether that leads to a diagnosis, but to be informed for the person themselves.
Yeah.
That what can they do then to perhaps help themselves feel less awful at times, or less critical, or whatever.
Yeah. Yeah.
I think sometimes people feel like they want a professional to validate it.
Yeah.
Isn't it? So I don't want the diagnosis, I don't want the label stuck on my face.
Yeah. Yeah.
But I want that validation that someone professional has actually said yes.
Yeah.
This
Absolutely.
is
I guess it's about being seen as well, isn't it? It's like then you're seen for all the experiences that you've gone through.
Yeah. Yeah. And it is really hard for us to be objective about ourselves as well. So, you know, actually having the recognition or the validation, the diagnosis from a professional is really helpful. Sometimes, I mean, I work with people who, you know, once we've had a bit of time to go into the challenges and the difficulties, that, you know, we can kind of agree on a working diagnosis, essentially, without the full assessment.
Okay.
I've certainly worked with people who say, well, I've known I'm neurodivergent for years, but you saying this is enough for me. They don't need to, you know, go through the full assessment. It obviously costs more money.
Indeed.
And a lot of people can't sort of afford that privately.
And I guess it's a long process, again, as we were talking about on the ADHD episode. I imagine going through the NHS is a long, protracted...
Yeah, it really can still take time. It can really take time. So it is possible as well to see somebody privately and actually say, well, I don't want this shared with anyone. You know, I think generally we like to encourage, you know, people to allow sharing of information with the GP. It's generally the best and safest and, you know, way to, it's what we should do generally. But if somebody really says they don't want that, then
they're not obliged to.
Not obliged to. We don't have to.
And just thinking about what you're saying around people not wanting it on their medical records, is there an impact of people having things like autism diagnosis on their medical records? How might that impact them, you know, in the way that they might be thinking?
Well, what I'm thinking is people that might be wanting to apply for the armed forces or something, that on there.
Is it?
I think so. I don't know.
I don't know. I don't know. I'm just wondering, actually, is it a myth or is it a reality?
Yeah. So I know a little bit more about this for ADHD, that if you are applying for the armed forces, there's a little bit more, probably I suppose you could say there are more assessments or hoops you've got to jump through, because I think the armed forces generally need to know that you can manage without treatment.
Yes.
And so that has to be shown and that has to be proved. Yeah. And maybe if you're on the autism spectrum, there's a similar process. They need to know that your sort of functioning and performance isn't going to be impaired at a sort of critical moment, those kind of things. So there probably is a bit more scrutiny, but I don't think it is necessarily exclusionary.
Right.
But I can't be absolutely 100% on that.
And also, I guess with all these things, again, it's recognising the value of people, like you were saying, with difference.
Oh, yeah.
And what they can contribute to all sorts of different professions and life.
Absolutely.
Yeah, which is so important.
Absolutely. I think, work can be a real struggle for people with autism. And there's quite a high percentage of people with autism who really struggle with full-time work or aren't in full-time work. But at the same time, if you're in the right work circumstances and you enjoy your work, and your particular autism traits can really have a hugely beneficial effect on your, if your area of expertise is something you're deeply passionate about, then some of the most interesting thinkers and successful people are able to sort of channel that and be incredibly successful. So it really is about everyone's unique and different, and
So just as we're coming to an end, Graham, is there something that you would like to leave our listeners and our watchers with, who perhaps have a sense that maybe they've got some kind of undiagnosed autism? What you would suggest to them?
So probably the main thing is learn about it. Read about it, listen to podcasts. I think don't think I mentioned already, but the Being Autistic podcast is one that I've just particularly found really useful. It's incredibly accessible, and so kind of learn a lot more about it, and maybe speak to friends, family. That can be, if you feel able to. It can be good to have other people's opinions, not always, but sometimes. The RADS assessment is something I think you can access online.
Okay.
And
so people can do that themselves.
People can do that themselves. It's good to go through that and just answer that as with what feels most right. And so that can be helpful.
And then once they've done that?
Yeah. So, obviously if you score very, very low on that, then you can be more confident that perhaps you don't have it. There is another questionnaire, I think it's called the CAT-Q, CAT-Q, that is around masking. So
how interesting.
You can actually kind of look into, I don't think it's as easy to score, but it can give you a sense of, at least help you understand what masking is. And
ask the questions.
Absolutely.
So we can put all those in the
show notes. It's really helpful.
Absolutely. And if you want to take it further, the NHS, it is still a good idea to speak to your GP, because even if there are longer waiting lists, it comes round, and it's
at some point.
Absolutely. And the sooner that you go down that path, the better. The sooner you get on that pathway. You can always jump off if you decide you don't need it.
Indeed.
But and then obviously there are private services, but there's the cost involved as well with that. So, but it's worth exploring. It's worth looking at.
Thank you.
Thank you.
So before we let you go, it's been great having you with us today, and hopefully there's been a lot of information for people. But as you might remember last time, we have our segment, which is Would You Rather? Would you rather? So, would you rather have no sense of smell or no sense of taste?
I think no sense of smell. I don't know.
Because handy,
it can be quite handy, But I know people said in COVID that it was really awful having no sense of smell. But I think I could probably live without that. It'd be harder to live without a sense of taste. I think.
I watched this, listened to this podcast with Davina McCall, and she interviewed Jo Malone.
Oh yes, she doesn't have a sense of smell, does she?
Does. It's back.
Oh, she lost it.
Her sense of smell is incredible.
But she did lose it, didn't she?
She lost it.
Yeah.
She had chemo.
But who is she?
Jo Malone. She made
perfumery.
She made perfume.
Oh right, wow.
Yeah.
Okay.
She's incredible. Like she can. She said she detected her husband's some illness that he had. She detected it through smell. She said, I can smell something's not right.
Oh, wow.
That's incredible. That's like they're trying to train dogs, aren't they?
Yeah, she said she's involved in training dogs. To
is she?
Yeah.
How fascinating.
It's a good podcast episode if anyone's
Yeah.
interested. So
My
you'd
stomach's grumbling again.
We need to give you some food.
Yeah, maybe it's talking about taste and smell.
taste. So you'd rather lose your sense of smell?
I would, yeah. I know quite a few people who are super tasters and super smellers. Certainly in my family actually. But yeah, I think I couldn't go without taste.
Mm-hmm.
Would you rather be extremely talented at one thing only, or pretty decent at a large number of things?
I would like to be pretty decent at a lot more things than I am. So I think I'll go for that one.
Okay.
Yeah. I feel like I'm probably less of a jack of all trades, and probably a bit more
master of one thing.
Yeah, maybe one
That's
and a half.
handy for us.
Yeah. Lovely. Yeah. Thank you, and thank you so much for being on.
Oh, you're welcome. It's been a real pleasure.
It's great. It's lovely having you, and hopefully you'll join us again sometime.
I think I will. Yeah.
Great.
It's good to be back.
I think you could be our regular spot.
She's already got ideas about this.
Yeah. No, it's been a pleasure. Great to be back.
Thank you.
Thank you.